Hi, I'm Garrett Williamson, one of the first-year residents at the Crosse-Mayo Residency program here in La Crosse, Wisconsin. La Crosse where, you may ask? Well, I'll show you the area in just a little bit. Now, I chose to come to La Crosse because it's a great program. Yeah, I know all residencies say that, but La Crosse is also a really fun city. I'd love to show you around in just a second, but first I want to introduce you to our main guy. He's Dr. Tom Grau. Now, he's been the residency program director here for some time, but he's still pretty cool for an old guy.
Thanks, Gehrig. I think you may be spending an extra year in our program for that age-related comment. Hello, I'm Tom Grau, Program Director of the La Crosse-Mayo Family Medicine Residency. Our program, with its long-standing tradition of excellence in graduate medical education, offers the one-on-one training experiences found in a small community hospital combined with the academic credibility of Mayo Clinic, one of the most renowned academic medical centers in the world. But the quality and uniqueness doesn't end there. It extends to our community. La Crosse is a river city with 3 colleges, and it is a community unlike none other. Small enough to know your neighbors, yet large enough to offer outstanding cultural and recreational opportunities. La Crosse has received many awards, including being ranked as one of the least stressful cities to live in the country, and has also received a 5-star rating for quality of life. La Crosse is not only a great place to live and raise a family, it's also home to an outstanding family medicine residency. We feel we have one of the finest programs in the country, and I invite you to come and visit us. I'm sure if you do, you'll agree with me, and you want to make La Crosse home for your residency.
Like I said, that Dr. Grau is pretty cool for an old guy. Now, he did mention that La Crosse is a river city. The Mississippi River, that is. If you like the water, there's plenty for you to do here. You can take a trip down the river on the La Crosse Queen, the Island Girl, or an extended cruise down the river on the steam-powered paddle boat, the Julia Bell Swain. There are several beaches to swim at, canoeing, or you can try your hand at a little fishing. Whoa! Looks like I've got a big one. Maybe I should try worms next time. Now I'd like you to hear from Dr. Marie Hill, a second-year resident.
Thanks, Gehrig. Remind me not to go fishing with that guy. But this truly is a fun city, and I could go on and on about it. But I suppose someone should mention our wonderful faculty. Because if you asked me why I chose this residency, I can honestly say that I was taken in by this faculty's friendliness and passion for teaching. This passion for teaching extends throughout the entire hospital. We are the only residents here, and this gives us a ton of one-on-one attention. Each doctor considers us part of the medical staff and considers this residency program an integral part of the entire hospital. I am proud to be part of this team. The faculty, the nurses. Did I mention we have our own staff of nurses? All highly motivated and committed to my training.
Marie's right about that one-on-one attention. Our program's relatively small with only 18 residents, so we do get a lot of personal instruction. And you get to make a lot of great friendships, so it's never hard to find someone to hang out with. La Crosse is known for its great bluffs and coulees. Whatever a coulee is. So if you like to ski, Mount La Crosse is just on the south side of town. And it's a pretty nice ski hill too. Man, I should have waxed these babies before I left. Here's another good friend of mine from the program.
Thanks, Gehrig. Remind me never to go skiing with that guy. I'm Candace Smith from Decorah, Iowa, and I'm a second-year resident. I do love to ski, but that's not the only reason that I chose La Crosse. You see, I looked at a lot of programs, but I chose the very best. I'm really interested in obstetrics, and my experiences here have been incredible. The mom is my patient, all during her pregnancy, in the delivery room, and after. Unlike other programs, I'm able to manage several patients that are high risk. I've been the delivering provider for a mom with diabetes and a mom with twins. But here's the really good stuff, taking care of the babies. You almost feel like you're part of the family. Sure, taking care of moms and delivering babies is a lot of work, but we still have time to have fun around here.
Good job, Candace. But what's all this talk about us having fun? I have no idea what she's talking about. You remember those bluffs I mentioned? Right now I'm standing on Gradnad's Bluff overlooking the city of La Crosse. If you look through the telescope, you can see our clinic perfectly. Hey, anybody got a quarter? I think I see my next patient. Uh-oh, it's my 11 o'clock bunion patient. Golf more your game? We've got more courses than I've got clubs. Four! Man, I gotta get these clubs regripped. Now here's a guy who did his residency here in La Crosse, and now he's part of our faculty. He's Dr. Dave Rushlow. He's a great teacher and a heck of a good guy.
Thanks, Gehrig. Remind me not to go golfing with that guy. Well, it's all come full circle for me. I actually trained at this program several years ago and then practiced in private practice for several years. I then had the opportunity to return to join the faculty that trained me. I'm just tied to this great city. This residency prepared me extremely well for practice. I couldn't pass up the opportunity to take those skills that I had learned and combine them with my desire to teach. Every year I'm impressed with our ability to attract highly intelligent, compassionate, and fun residents, and I couldn't imagine doing anything else.
Thanks, Dave. Hey, do you like baseball? Well, good. You'll have to come see the La Crosse Loggers. They're a pro baseball team that plays here in La Crosse in this beautiful stadium. And if you come to the game, make sure you bring your glove. Ugh, darn pigeons. If you like to play ball yourself, you may get a chance to play on our resident softball team. Now we're so good, you may even get a little practice with your dental procedures during the 7th inning stretch. Now, here's a lady everybody likes. Her name is Sherry Olson. She's one of our faculty members. Now she's fun and she knows what she's talking about.
Thanks, Gehrig. Remind me not to play baseball with that guy. One of the ways our program is different and set apart from other residencies is that we involve our residents a lot in the community. For instance, once a month, residents and faculty in small groups go out and visit local community organizations like the Alzheimer's Association, a local hospice, and transitional housing units. In the springtime, residents help put on a human body expo at a local elementary school. There they develop hands-on workstations that help enhance the science curriculum for some very excited 5th graders. Residents and faculty also see patients at the St. Clair Health Mission, a local free clinic that takes care of patients without insurance. The residents even assisted in organizing and participating in a recent run to help raise funds for the mission. Add to that free physicals for underserved youth, chemical dependency lectures to a local halfway house, and talks to college students at neighboring universities, and you can see that our residents are very involved in this great community. I'm proud to be part of an organization that supports community involvement and part of a community that makes being involved easy and fun.
Thanks, Dr. Olson. I almost forgot. There are some great hiking and biking trails in the area for you to try. La Crosse has some of the most beautiful scenery in the whole country. Well, that's about it from here. I hope I've been able to convince you to give our residency program a good look. And make sure to mention my name when you get here. I get $5 for everybody I sign up. So I better get going back to the clinic to see those patients I have waiting for me. I hope to meet you real soon. Hey, you're supposed to do no harm, man. This hurts. Hey, did I mention I'm a resident here? I get the 10% discount, right?
Remind me never to go biking with this guy.